Good afternoon. This is Mike Berkley, licensed acupuncturist and founder of the Berkley Center for Reproductive Wellness. Welcome. Today is Tuesday, June 8th, 12 o'clock in the afternoon. So I just wanted to give a brief presentation on what acupuncture can be used for in the context of reproductive disorders. We have patients that come into the Berkley Center every day with elevated FSHs, even FSH up to 25. And our thinking, our concept, our philosophy, if you will, is that even if a woman has an FSH of 20 or 25, as long as she has a regular cycle, she does have a chance to conceive using her own eggs. It's a small chance, but we believe at the Berkley Center that every couple and every woman deserves a chance to try to conceive with her own eggs. After all, elevated FSH is really more of an indication of low ovarian reserve than it is necessarily of poor egg quality. And this is why there are women with elevated FSH that get pregnant, either with IUIs or IVFs or even intercourse. Yes, it's not as common as it is with a woman who's 25 years old with normal hormonal parameters, but those are not the patients that we see. So that's number one. That's one thing I wanted to say to put you at ease. Endometriosis patients, obviously the patient needs to have a laparoscopy and eradicate the endometriosis, but not all endometriosis is eradicated during a laparoscopic procedure, and as a result of the remaining remnants of endometrial adhesions, there are still inflammatory processes that are going on inside of the uterus, which can make it hard for an embryo to implant. Acupuncture and certain herbal medicine can help reduce these inflammatory processes in the absence of corticosteroid medications. Women with polycystic ovarian syndrome, they have many follicles but immature eggs, and usually they are anovulatory, meaning they don't ovulate. Acupuncture and certain herbs have been shown to help PCOS patients mature their eggs as well as induce ovulation and get pregnant naturally, or even help the PCOS patient who is refractory, meaning she doesn't respond well to IUIs or IVFs. So we'll include acupuncture and herbs in the cycle of IUI and IVF, because 1 + 1 = 3 in this case. We're doing complementary medicine and conventional Western medicine, and we often see good outcomes. Idiopathic infertility, meaning 35-year-old woman comes in, her hormone levels are normal, there's no male factor, she doesn't get pregnant, her tubes are open, no disease state, she doesn't get pregnant. We treat these patients with quite a good success rate very frequently. Male factor infertility, whether it's morphological problems, motility problems, low sperm count, or sperm DNA fragmentation, there are methods and techniques using acupuncture and herbal medicine to help treat male factor. This, of course, is not possible if there's anatomical problems with the testicles. For example, congenital bilateral absence of the vas deferens. This is an anatomic abnormality. Of course, acupuncture and herbs can't help this. But in the absence of anatomic distortion, with low testicular function, acupuncture and herbs can be quite helpful very frequently. And of course, last but not least, there is some science out there that talks about the relationship between stress and infertility, and obviously acupuncture is a very known contributor to the reduction of stress. So if you have any of these things, or even if you have other causes of infertility and you'd like to discuss them with me on the phone at no charge, it would be my pleasure to do so. You can reach me at 212-685-0985, and our website, of course, is berkleycenter.com. That's Berkley center.com. Once again, I'm Mike Berkley, founder of the Berkley Center. I want to thank you all for watching. I wish you Godspeed on your journey to starting or growing your family. Thanks again, and I look forward to speaking with you soon. Bye.